morning. My name is Dinaliza Calderon. I'm the Laboratory Manager here at Lakeside Medical Center. I have been with the district for 25 years. Well, I came back in 1996 as a medical technologist, generalist, going into the laboratory, and that was from Glade General Hospital. Actually moved the laboratory from the old Glade General Hospital to here at Lakeside. That was an experience of a lifetime that I take with me, because that's a very rare opportunity for anyone to be able to move a laboratory 100% from one location to the other. But we are a Joint Commission accredited laboratory, so meaning that the laboratory is basically surveyed for accreditation to make sure that you are in compliance with each regulation. And just to actually give out there that the laboratory is a very highly regulated laboratory. That means that we do have standards to comply to in order to be able to provide the services to the physicians for their assessment to the patients. Being in the field for 25 years and getting into how we had improved, just getting into the biannual accreditation survey, you tend to know what you haven't been doing well, and then every time you improve on that opportunity, and then you could tell that you had that good opportunity of improvement. So the next time that you are surveyed, then you get those deficiencies, I would say, that would be surveyed and then being rated that you are in compliance with. The last survey that we had, because of the pandemic, was really a challenge for Joint Commission to come in person. So we did have the opportunity to actually have a full virtual survey. And despite of being surveyed via virtual survey, and still very tedious, but we did well. Yes. During the pandemic, it actually gave the laboratory that opportunity again to get into a new testing that would serve the community in order to be treated. That gives us a result within 15-20 minutes, and then able to get and provide the results to the physicians. And there is a PCR testing, and because it's a methodology that we don't have in-house, so we do send it out to our reference lab. For our area in here, I considered it that we do have state-of-the-art laboratory, being that we do have all the state-of-the-art instrumentation that is comparable to other labs on the coast. So even being here in the area, being here in Belle Glade, like what I've said, I have always taken pride that we are comparable to what other laboratory have. Most of our instruments have a backup of the same model, so that the continuity of service is always provided. Well, yeah, the laboratory is composed of different personnel. We have the phlebotomists, and those are the laboratory staff that are the frontliners of the laboratory. So they're the ones that goes out and have more of patient interaction, because they are the ones that draws and collects the specimens that they bring down to the laboratory. And then we do have the medical technologist with a bachelor's degree in medical technology and have licenses. So for the state of Florida, we have to have license in each sections of the laboratory in order to be called generalist. Each department of a hospital in a healthcare setting plays a vital role, and for the laboratory, it's like, for example, a patient comes to the ER. In order for the physician, the laboratory requisitions are one of those that they would need to assess the patient. So from that time that the tests are ordered, from there, we receive the orders, and then our phlebotomists go to the patient and draw whatever is being requested. Then they come back to the laboratory and do the receiving and processing And from that point, they would distribute it to each section of the laboratory. And then once we have the result, then it goes back directly to the physicians, and they're able to actually see what the results are in order for them to assess and treat the patient. Hopefully, the highlighting the laboratory now will go get out there and get, interest for the younger generation to go to school and be a laboratory medical technologist. Thank you so much for having us.